Hi, everyone, and welcome to our Health Talk. My name is Alina, and my pronouns are she and her. On behalf of the Patient Education and Engagement Program here at the University Health Network, thank you for watching this session on heart health and nutrition in celebration of Heart Month. At UHN, we strive to provide safe and inclusive care, and that begins by honoring Indigenous peoples. Indigenous peoples are the original inhabitants of this land, and for thousands of years have cared for this land. Although we are presenting this health talk in the digital world today, we want to acknowledge and remind ourselves and encourage you to do the same too wherever you are currently located, that we are still on the traditional territory of many nations, including the Huron-Wendat, the Haudenosaunee, and the Mississaugas of the Credit River. This territory is governed by the Dish with One Spoon Wampum Belt Treaty, an agreement to share, care for, and protect the resources around the Great Lakes in peace and respect. Today, this territory is still the home to many Indigenous peoples from across Turtle Island, and we are grateful to have the opportunity to work, learn, and play on this territory. We want to take a moment to thank those who have submitted questions for the speakers. The speakers will answer some of the questions at the end of the presentation today. And a reminder that you can start asking questions for the next health talk at the beginning of every month. This helps us to see what people are interested in learning about most, allowing our guest speakers to tailor their presentation to the questions being asked. And with that, I would like to take a moment now to introduce the speakers for this session. Rick is a two-time graduate of the UHN Rumsey's Cardiac Rehabilitation Program, having first joined the program in 2016 after a stroke and then returning in 2022 after a heart attack. He is now retired from the workforce and now does contract work with his former employer. He was an active participant in the cardiac rehab program and continues to advocate for the importance of ongoing cardiac health. And Dr. Paul O is the medical director and Good Life Fitness chair, works at the Cardiovascular Disease Prevention and Rehabilitation Program and the Peter Munk Cardiac Center at the Toronto Rehabilitation Institute. And finally, Veronica Rouse graduated with a Master's of Applied Nutrition from the University of Guelph in 2010. She's a certified diabetes educator for the past 11 years and has currently been working at Toronto Rehab's cardiac rehab for 7 years. And our wonderful speakers today will speak about understanding heart health, how the heart works, and the symptoms to watch out for in your heart health, and foods you can eat to support a healthy heart. And with that, I would like to pass it off now to Rick, who will share with us his story today.
Hello, my name is Rick Reed, and I'm a heart attack survivor. Almost exactly a year and a half ago, I had a heart attack, and that was very surprising to me, as I didn't think I had any risk factors. I didn't think I was vulnerable, and my doctor didn't think so either. And I wasn't doing anything out of the ordinary at the time. In fact, it couldn't have been any more ordinary. Maybe a bit about me might be a good place to start. I'm 63 years old, live in Toronto, and have teenage kids. I was employed as an airline pilot, loved my work, enjoyed my family, and felt pretty much on top of the world. So what happened, you might ask? I was doing the dishes, and this is not intended to be a risk factor. I don't think dish doing is bad. I still have to do them. But I was doing the dishes in the late evening because we've been entertaining some guests by the fire pit at our cottage north of Toronto. While I was doing the dishes, I started to feel some tightness in my back, between my shoulder blades, as if I'd been lifting weights. Now, I was pretty active and did lift weights regularly, so I was familiar with the feeling. But I hadn't been lifting weights recently, and so I shouldn't have been feeling that, but it was there. I didn't think much of it, because sometimes you feel things. But it migrated to a bit of tightness in my chest. And not like we hear about heart attacks with a crushing pain and things like that. It was nothing like that. It was just chest tightness, and it was uncomfortable. And I sort of took note of that and thought, this is odd. And then while getting ready for bed, I was brushing my teeth, started to feel some tightness in my jaw. And that's kind of when it hit me. These are all the symptoms that are part of the constellation that can indicate a heart attack. Just an aside, I probably wouldn't have known that had I not been already through the cardiac rehab program and was very familiar with the symptoms of a heart attack. At the time, I didn't really believe I was having a heart attack, but the symptoms were persistent enough and present enough that I knew I probably wasn't going to get much sleep that night. And as the minutes went on, I became a bit more worried. And eventually I had my wife drive me to the hospital in the nearby town of Bracebridge. And that's where I was diagnosed with a heart attack. And I was gobsmacked. A little more history is in order to understand why I was thinking I wasn't a candidate for a heart attack. In 2016, I suffered a stroke while I was at home by myself in Toronto. Ended up going to Toronto Western Hospital. I was treated there for my stroke and fell under the care of one of the best neurologists in the country, to be honest. And I was very lucky in that respect. Notwithstanding a comprehensive and detailed investigation over many weeks, the source of the clot that caused my stroke was never found. And my neurologist said that for a person of my age, and I was 56 at the time, with no obvious risk factors and no family history, it wasn't unusual not to find the source of the clot. Through good luck and some excellent rehab, I fully recovered from the stroke with no deficits, was able to go back to work. The last part of my stroke rehab was at the Toronto Rehab Institute downtown on University Avenue, and my rehab therapist asked if I wanted to enroll in a cardiac rehab program at the Rumsey location. And that was my first time at Rumsey. Through the strong support and encouragement of all the staff there, I continued my recovery to the point where I was fit as I could hope to be. I learned how to care for myself, exercise regularly, diet, and the importance of a strong social network. And I thought that's where this story was going to end. I continued doing regular cardiac stress tests. I had imaging done on my heart and lungs. As we were looking for the cause of the stroke, my diet improved. And while I might have been 10 pounds overweight at the time, through diet and exercise, my weight dropped almost 30 pounds. So fast forward to the spring of 2022, 5.5 years later, I was running 20 miles a week, lifting weights twice a week, non-drinker, weight suitable for height, blood work impeccable, cholesterol being checked annually, blood pressure managed without drugs to below 120/80, no family history of heart disease, and annual cardiac stress tests at the cardiac rehab at Rumsey, and showing no abnormalities. In fact, my fitness level was that of a man 30 years younger than I was. I thought I was in great shape, and I probably was. But there I was in the hospital, being told I had a heart attack. I ended up at a hospital with a cardiac ICU, and almost immediately on arrival, we went into the cath lab and had an angiogram. It didn't surprise me at all that the cardiologist told me my arteries were clear and no obvious cause for my heart attack could be found. I was up walking around the next morning and felt great, but didn't take away from the fact I had just had a heart attack. I was having a lot of trouble reconciling that in my mind. It just didn't make sense. And I do often say that it's better to be lucky than smart, and I was lucky again. I know it doesn't seem lucky to have a heart attack and a stroke, but there you are. It happens that the hospital I'd been taken to is the home of what was, at the time, the only cardiologist in Canada that could properly investigate the small vessels of the heart. I met with him about a month after my heart attack, and he explained that what I'd had would be classified as a MINOCA, myocardial infarction, with non-obstructed coronary arteries. This is not a typical heart attack. It's more often found in postmenopausal women and has some similar characteristics to a Takotsubo heart attack or Takotsubo syndrome. Essentially, the small arteries in my heart were not flowing blood sufficiently. Now, fortunately, because of my previous trip through Rumsey, I had a pretty good knowledge of how the heart worked and its physiology, so I could understand what he was saying. But just to be clear, the heart has 4 primary arteries and they supply blood to the heart muscle. When one or more of those get blocked, that's a heart attack. That's the usual way. However, in my case, that was not my way. These 4 main arteries feed into smaller arteries and ever smaller arteries and right out to the capillaries that actually get the blood to the heart muscle. It's easiest, I think, to think of them as a tree trunk and then gradually spreading out into big branches and smaller branches and out into the twigs at the end. And those twigs are like the capillaries. An angiogram can't see into those small arteries. And most likely what happened to me is those small arteries were not flowing enough blood. My cardiologist said he had some diagnostic techniques that were unique in Canada, and he could find out what the problem was and how to treat it. So after a thorough investigation, And that examination, I can say with confidence that I have something called coronary microvascular dysfunction. Essentially, my smallest coronary blood vessels sometimes do not dilate to allow sufficient blood flow for my heart muscle. In fact, sometimes they even contract when they should dilate. This is an area of heart disease that is not fully understood. However, it's often related to endothelial dysfunction and can sometimes be triggered by stress and or anxiety. Knowing that's what happened, and it was going to be a period of time while I was waiting for this diagnosis, I called up my former friends at Rumsey and said, hey, it looks like I'm coming back. And they welcomed me back. There'd been a few changes since my last time there. We're just coming out of COVID, so the program was hybrid with some visits in the facility and some online, but the program was more or less the same. And that's where today's story really starts. I relearned the importance of ongoing exercise, a healthy diet, and the importance of living a balanced life. The treatment and education in a cardiac rehab program gave me the knowledge to know that what I was feeling when I had my heart attack wasn't normal and needed to be investigated. It also gave me the tools to recover and continue to lead a healthy life. I see cardiac rehab as not something I've been to or something I did, but rather I see it as something I do every day. And that was the message I got loud and clear both times I've been at Rumsey. I think of it as a little bit like, and forgive the comparison, a little bit like substance abuse rehab. You go to an intensive program to clean yourself up. In my case, that was the first time I was at Rumsey. But once you leave the program, you will always be somebody that has heart disease. That never leaves you. And every day when I wake up, it's a new day, and I start the rehab journey again. I make choices about what I have for breakfast. I make choices about my activities for the day. I decide whether or not I'm going to exercise today. And the answer should be yes. But every day when I get out of bed, I'm still a heart attack survivor, and I still have work to do. The other lesson is that cardiac rehab is a journey. It's not a destination. And on that journey, it's okay to get off track. In fact, life will conspire to throw you off track. That's okay. Just knowing that and keeping moving forward towards your goal. Post-cardiac rehab, the intensive part, you have all the knowledge you need, and it's okay to restart the journey if setbacks get in the way. Sometimes those setbacks will be self-imposed. Maybe you just didn't feel like exercising for a week or two. You haven't failed. You've paused. And when you're ready, restart the good habits that you know, and you'll be back in the groove before you know it. There are no guarantees in this life, and notwithstanding my best efforts to live a healthy lifestyle, things can happen, like coronary microvascular disease in my case. But I look on maintaining my healthy habits that I learned in cardiac rehab as stacking the odds in my favor. No guarantees, but I'm giving myself the best chance that I can.
Thank you so much, Rick, for sharing your story with us. It's really inspiring to see your journey and everything you've learned throughout the process, and just to learn more from you. So thank you. Thank you for sharing that.
It's my pleasure. It has been a pleasure to be involved with the cardiac rehab people at Rumsey. They literally, without a word of a lie, have probably saved my life twice.
It's wonderful. And it's a great segue to hear more from Dr. O. So I'll pass it over to you, Dr. O, to speak about heart health.
Thanks, Alina, and thank you, Rick, so much for sharing your story. So much wisdom in your kind of guidance and reflections, and you presented a lot of great detail about the underlying physiology of the heart, which is a great place for us to pick up with this section of the presentation. We're going to go back actually a couple of steps about just understanding what's going on inside of our hearts, and then interweave parts of your story as well. Let's advance to the next slide and talk about what does the heart do kind of from a more fundamental 101 level. The heart, we'll remind ourselves, is this amazing muscle that lives in the middle of our chest, and it pumps 100,000 times per day and sends blood all through the body. If we advance one more, that each heartbeat will send oxygen-rich blood around the body to nourish our muscles and let us do things like move and exercise on a regular basis. Next slide. How does the heart achieve this? Rick actually alluded to some of the anatomy that's inside of us. that the heart does indeed have 4 different chambers. The upper ones are called atria. The lower, larger ones are called ventricles. They are separated like rooms with doors by valves. The right side of the heart is responsible for pumping blood to the lungs into those very small blood vessels, and there's an oxygen exchange there that happens. Carbon dioxide is dropped off in the lungs, oxygen is picked up, it's returned to the left side of the heart, and from there it's pushed out to the body. So this amazing thing that's happening over and over again, 60, 70, 80 times a minute, 100,000 times a day. Next slide, please. Beyond the pumping, there's other systems that live within the heart as well, and they all work in concert. And we might think about it like the structure of a house. And we're familiar with a house with walls and a roof and a chimney and doors and windows. And the systems that keep our houses working efficiently include things like plumbing and electrical, the doors and the windows that seal well but open seamlessly, and the walls that hold everything up. Well, within the heart, if we advance one, we have similarly a plumbing system, the blood supply. Next, the electrical system, we'll see that there's wiring throughout the heart. The valves, which represent the doors and the windows that separate the rooms and control flow, and the overall muscle pump function. So we're going to return to this analogy a couple of times because we can always think about things that may go awry inside of our houses. Well, the same things can actually happen in our hearts. Next slide, please. So there are diseases then that we think about, and I use the term in quotation mark. There are conditions, there's dysfunction, there's things that happen over time. So if we think about the blood supply, first of all, if we that conditions that affect the blood supply are often lumped under the term called coronary artery disease. The blood vessels of the heart, another term for heart is coronary. Artery is the blood vessel that carries oxygen down to the muscle, and there are various kinds of conditions that can affect those coronary arteries. And Rick has told us about a couple of variants of that. The electrical system is subject to problems, short circuits, breaks in the wires, so to speak. And these are termed arrhythmias. When you see the term A at the beginning of a medical word, that means something's gone wrong with that. Like that's a bad rhythm. We're familiar with rhythm, like the tapping of a musical program. So bad rhythms that can happen in our electrical system. Too fast, too slow, and we'll talk more about that. Valvular problems, too tight, too loose, and problems of the heart muscle. Cardio, that's familiar to you as the heart. Myo is muscle, and pathies are things that go bad. So heart muscle badness, heart muscle disease, and these are the conditions that can affect the different systems. Next slide, please. So the most common kind of heart problem that we think about, and when people talk about heart disease, often they're talking about coronary artery disease. And Rick sort of talked about that in the context of his heart attack or myocardial infarction. Most often, or the most common condition that affects us in Canada is narrowing of the arteries that occurs progressively, like clogging of the pipes in the plumbing system of our houses. There is this buildup of plaque, atherosclerotic plaque, that's fatty substances, inflammatory cells, scar tissue that builds up in the walls of our arteries. And as that cartoon demonstrates, progressively over time, typically decades, there is narrowing that occurs in those arteries. Rick has also described to us that in the smaller blood vessels beyond these kinds of blockages, there may also be narrowings like this. There may be clots that happen, but there also may be problems in how the blood vessels squeeze or relax. And Rick has described that microvascular, small blood vessels that may not relax properly. And that was what was characterizing Rick's condition. Okay, next slide. Flipping to the electrical system, that just like the wiring in our house that might start with that big fuse box, gets the cable of electricity from the road to the house. And then there are wires that go through our house to the various rooms and light switches and appliances. Well, the heart also has an electrical system that starts with this kind of generator in the upper right part of the heart. It's labeled the sinoatrial node. That's kind of just the anatomic description of where it sits. And then the red lines represent actual electrical cables that flow from that section down to the lower parts of the heart. And the electricity flows from that upper right part down below, and that's how an electrical signal is generated. To the left-hand part of this slide, you'll see a representation of the electrocardiogram or ECG tracing that corresponds to that electrical signal traveling from the upper right part of the heart to the lower left part of the heart. And we can look at the configuration and the pattern of these waves that are labeled with these letters, P, Q, R, S, and T, and we look for that regular pattern. When we see those spikes in regular sequence, we think, good, the electrical system is working very well. But when the signaling seems to be off, either it's in an irregular pattern or parts of it are longer or shorter than they should be, then we can see that there is something going on with this heart's electrical system. The next slide is going to show us a little bit more information about this. If we move to the next slide, that usually the heart has a native rhythm, that this electricity signal has a pattern to it. And if we advance, that the electrical signal travels between 60 and 100 beats per minute, usually at rest. And usually it's quite regular. You could sing a song to this kind of heartbeat at rest. And we call this normal. Sinus, meaning that the beat originates in the upper part of the heart, and then the rhythm is that it's a regular rhythm, and that's would be called normal sinus rhythm. You know, most people are in this kind of rhythm at rest, but some of us have irregularities in the heartbeat. Next slide. We'll talk about the kinds of irregularities, and sometimes we can go too fast. Now, that might be deliberate because we're exercising, but for some people, the fast heartbeats just may take off without us doing anything at all. On the other hand, over time, heartbeats can become too slow. It's like the electrical system in our houses starts to wear out, and the electricity just doesn't flow. There's a glitch in it, and that requires us to kind of help with new electrical wires in the heart, like pacemakers. Or there may be irregularity in the heartbeats as well, and each of those can create issues. The symptoms of the irregular heartbeat, just overall, if the heart isn't pumping on the regular cadence, we may become tired, or we may feel dizziness if the blood isn't flowing up to our heads, overall feeling weak. Unusually, we might feel some kind of discomfort in our chest or shortness of breath because we can't get the oxygen supply that we need as we're moving. But some people describe things like palpitations, the sensation of fast or irregular heartbeats in our chest. Okay, next slide. We'll talk about a common example of an irregular, typically fast heartbeat that's called atrial fibrillation. We highlight this one because it does affect more people as they age. 5 to 10% of the population of older adults may have atrial fibrillation as their new kind of underlying heart rhythm. And it's characterized by irregular heartbeats, or in irregular heartbeat, I should say. The reason that it happens, on the left-hand part of this slide, we see the usual kind of electrical signal that starts from that generator called the sinus node, then travels down the electrical pathways in a regular way. But on the right-hand side, the condition of atrial fibrillation is that there's a whole bunch of random electrical generators. They're all fighting and firing off fairly quickly, so that there's more chaotic electrical signals are coming down. Now, again, it's not nice to have fast rhythms because we don't have efficient blood flow. And there's a chance when that irregularity happens that the blood does not get ejected properly from that upper chamber. And there may be an opportunity to develop small blood clots up in that heart. So that's a dangerous thing that can lead to conditions like a stroke if that clot flies off from the heart and lands up in the brain. And that's why, in addition to trying to get these heart rhythms regularized, sometimes we need medications like blood thinners to prevent some of these other complications from happening. Okay, next slide. Let's move on to the valves as the next part of our story, a journey through the heart. And the panel over on the left-hand part of the slide kind of highlights where these little delicate valves, you can almost see like they're bifolding doors in a way that separate the different rooms, the upper atrium from the ventricle from the main blood vessels. And you can see that there's 4 different valves in the body. And when things are working well, the door shut, the room fills with blood, the door opens, and then the blood moves on, and that just keeps going on. Again, 60 to 100 times a minute, 100,000 times a day. Okay, next slide tells us about where things might go wrong. The left-hand part talks about if the valves become sticky, if they develop calcium deposits over time, if they develop wear and tear, they may not open and close particularly well. This is a condition called aortic stenosis, meaning closing. And think of it like a sticky door that you can't close particularly well. You have to fight it to get it closed and or open. Now, the heart doesn't function very well. It likes to be nice and fluid and opening. So if these valves get progressed over time, then they may need to be replaced. On the other hand, on the lower right-hand side is a picture of a valve where there's leakiness. You can see that instead of being nicely opposed, that there's this separation or gap that happens like a drafty window. So air is moving in all the time. In this case, blood is flowing back and forward all the time as well. And in either situation, it's not the ideal circumstance. And that's why valve replacements may be in order, or repairs of these valves. Okay, next slide. And finally, we'll move on to some pump problems. Here, the left-hand panel talks about the familiar. Now you're very expert at seeing these pictures of the hearts with the upper and the lower chambers. And you can appreciate that it has a fairly streamlined view of the heart as a nice kind of cone shape, which is very efficient for pumping out blood. For some people, either because of 1 or more heart attacks that may affect the heart and weaken the muscles, or other conditions that may affect the heart muscle, you can appreciate the picture over on the right-hand side shows you a heart that's big and stretched that doesn't pump particularly well. And in this case, it's going to have trouble pushing blood around to us. This condition is called a cardiomyopathy, again, heart muscle problem. We may also term this condition as heart failure, meaning that the heart pump isn't pushing things out as well as it should be. Okay, next slide, please. So we have characterized each of these problems of the systems of the heart. What are the common symptoms that we might watch for? And again, they may not be all that specific, and we may want to evaluate all of this together if we present with anything that is suspicious for the heart. In terms of coronary artery disease, if there is narrowing of the blood vessels, as Rick told us while he was sitting around the fire, that he had back discomfort. Some people may feel this as chest or arm discomfort, or something more subtle, like shortness of breath, instead of having actual pain. We talked about the arrhythmias or the electrical heart disease, that we may feel the palpitations of racing, fluttering, or skipped beats. The valvular heart disease, when the doors and windows get sticky or don't open particularly well, or if they're leaking, some people feel discomfort, some people feel shortness of breath or fatigue. And then finally, with the heart muscle problems, when the pump isn't pushing things out as well as it should be, we may feel short of breath when trying to get out and about. Or if the condition advances, we may actually feel short of breath when we're sitting around. And we may start to accumulate fluid in our body because it's not being pumped and pushed around and expelled from the body. So we may get swelling in places like the legs, and we may feel that our weights are going up as we accumulate water as well. So important things to watch out for with our overall heart health. Next slide, please. So what are some of the solutions? Well, there's many. We touched upon some surgical things that may happen, devices that may be implanted, medications that can help this overall system. And Rick has already provided a wonderful backdrop to our corner of the world in the heart journey, and that is cardiovascular rehabilitation. Rick has described the importance of getting onto a program of sorts. And, it could be a 12-step program. Here we have a 5-step program that most days of the week, we would love you to be active in a way. 30 minutes, 5 days a week is a tried and true recipe. You can do more, you could do less, and just be active through your day. layer in some weight training a couple days a week. Veronica is going to tell us all about the importance of heart healthy diet, so won't spend much time there. Important to make a plan with your healthcare provider, but more importantly with yourself, as Rick has said, that getting a plan, an action plan, setting goals, getting motivated every single day, as Rick has embraced so well, and he's such a wonderful role model for this. We really appreciate. And then getting yourself educated and up to speed about the heart. Sometimes we are left with complex things and we don't get a manual on how to look after them. We will for a little appliance, we don't for our own health. So if you wanted more information, come on and visit our websites. Alina's going to show you that a little bit later. But if you do all of this stuff, there is this opportunity, as Rick has indicated, that we can improve fitness, we can improve function, we can improve quality of life, we can improve longevity of life as well, and stay out of hospitals. Next slide, please. So thanks very much for allowing me to share some of this information about the heart.
Thank you, Dr. O. You provided great insight into how the heart works and various factors to watch out for. And this allows for a great transition to Veronica, as you mentioned, who will speak about healthy foods to incorporate into our diet.
Great. Thank you for having me. And I also want to say thank you to Dr. O for setting the stage of how complex our heart is and how important it is to keep it strong. And also a big thank you to Rick, because he had highlighted the importance of nutrition and diet and making those daily food choices. And that's what I hope to break down for you today, is those exact foods that you should be eating more often to strengthen our heart. Now, one of the common questions I receive as a dietitian, clients come into my office and they say, "Hey, Veronica, just tell me what to eat. What is the diet? What is the best diet to eat?" And unfortunately, there's no right way to answer that question. Even the American Heart Association doesn't suggest one particular diet for everybody. They do suggest these 3 diets, which are on the screen. These are actually called eating patterns. And the first one here is vegan or vegetarian eating pattern. The middle one is the Mediterranean diet pattern. And then the last one is called the DASH diet. And I'll jump into what each of these ones are, but think of them, and I'll break them down or maybe highlight the similarities of them going forward to show you which types of foods to include more often in all of these eating patterns. So we'll start in jumping into the vegetarian or vegan dietary pattern. All of these eating patterns were in the shape of a pyramid. So just to orient you, what they recommend is eating most of the foods on the bottom of the pyramid every day, and then less and less of the foods as we go up throughout the day or maybe throughout the weeks. And one of the best things I think about this vegetarian or vegan diet pattern is actually the bottom of this pyramid doesn't have food at all. If you can see, it has physical activity, which we spoke about, but it also has individuals cooking at home more often, cooking with whole ingredients, cooking with more plant foods, enjoying foods with others, maybe without distraction, without screens, eating at the table. So really important thing to consider, that it's not just the food we eat, but the practices we have. And when we do cook at home more often, it shows that we are including more of these plant foods, which is exactly what this vegetarian and vegan diet pattern suggests. So you can see very clearly we have lots of color at the bottom of the pyramid. Those are your fruits and vegetables. And then as we go up, we have our whole grains, protein from plants, and then some of our healthy oils as well. The next pyramid is called the Mediterranean diet. Again, the base of this pyramid, the structure of the pyramid, is nothing to do with food, but physical activity, eating with others, cooking at home more often. Something to consider. Like that vegan, vegetarian diet pattern, the bottom here, lots of color. So it does include those fruits and vegetables. It includes protein from plants as well. You can see some beans and legumes like black beans, kidney beans, chickpeas. Has some healthy oils. So extra virgin olive oil is right in the middle there, maybe some avocado, some nuts and seeds, and it has your whole grains as well. And then as you move up the pyramid, They suggest fish more often than chicken or dairy. And then at the very top, we have the red meat and the desserts. And then the last dietary pattern is something called the DASH diet. Now, this is an acronym. It stands for Dietary Approaches to Stop Hypertension. And so hypertension meaning blood pressure. So if your blood pressure is high, this is one of maybe the diet patterns to pay attention to more often. It is, again, in the shape of a pyramid, and at the bottom, we have those plant foods. We have the fruits, the vegetables, the whole grains, and then it emphasizes dairy and meat, as well as fish more often than the beans and nuts. So a little bit different there, but still pretty prominent in the eating pattern. So those are the 3 patterns of eating that the American Heart Association recommends. And again, it's not necessarily something you need to follow to a T. You don't have to pick one and stick with it for the rest of your life. But let's look at what these patterns of eating have in common. So we saw at the bottom of the food group, or sorry, bottom of the pyramid, we had lots of color. That's our vegetables and our fruits. We had the whole grains, things like barley, quinoa, even pasta was there. We had healthy fats from our nuts and seeds, and then protein from plants, which were those legumes, things like lentils, chickpeas, kidney beans, for example. And what do these all have in common? Well, they're whole foods. So they're foods that are not processed. So foods coming right from nature, and they're foods that come from plants. So if we keep it simple, that is what we want to focus on, and that will help you strengthen your heart. So why are these whole foods important? Well, they're naturally high in fiber. So foods that are not processed, ones that come right from nature, are generally high in fiber. And fiber is really important for things like blood pressure, blood sugar control, cholesterol management, weight management as well. So extremely important nutrient that we're not getting enough of in Canada. And that's because we're not eating enough of these whole foods. We're eating more processed foods. Whole plant foods are also rich in healthy fats. So we're looking at something called unsaturated fats here. Those are the fats found in our nuts and seeds, our legumes, as well as our extra virgin olive oil. These whole plant foods are naturally low in sodium, and they have no added sugar. So instead of trying to think about all your foods and saying, oh, I need more fiber, I need more healthy fats, I need less sugar, less sodium, all you need to do is think, am I eating whole plant foods? And then you'll be meeting these guidelines. So let's look at some specific foods and how often to eat them, maybe some portion sizes and how to include them. So one of the most tasty, I think, heart healthy foods are nuts or seeds and nut butter. And having these at least 3 times a week, but I really recommend almost every day if you can be helpful to add those heart healthy fats, but also some nutrients like potassium, magnesium, and calcium. It's a small serving. All you need is 1/4 cup or maybe 2 tablespoons if it's a nut butter. So it's not a lot. I recommend just starting your day with this and your breakfast. And that way you have a more balanced breakfast. Usually our breakfasts are carb heavy. So adding some of our protein from plants here, as well as some healthy fats, can balance that out. Fish is an extremely important heart-healthy food as well, and it's recommended to eat 3 times a week. It offers a great source of protein without the fat that can increase our cholesterol, which is called the saturated fat. So fish are naturally low in saturated fat, so it's a great source of protein to include. And then it also has an essential fatty acid, which is called omega-3 fatty acid. And essential means our body can't make it. So it can't take other nutrients and form it together. We need to consume it. And so that's what we want to do through fish. So 3 servings a week is a great way to do that. And a serving is about 3 to 4 ounces. We have a picture here, which is a calculator as an idea of the serving size. Some people fight me on this example, and they suggest maybe we should update it to an iPhone. So you can think about that as well if you wanted. But fish, particularly things like salmon, trout, sardines, mackerel, those are really rich, omega-3 rich food. And what if you don't eat fish? People don't eat fish for a lot of reasons. Could be religious, cultural, could be you don't like fish, could be you're allergic to fish. So we still want to try to make sure that we're eating those essential omega-3 fatty acids. And there are some plant sources of omega-3 fatty acids. They are chia seeds, hemp seeds, ground flax seeds. Walnuts are a great source, as well as our canola oil. So those would be things to focus on, and having these every day would be important if you're not eating fish, in order to make sure you're eating enough of those omega-3 fatty acids. Another question I get a lot is about supplements. Well, how about I just supplement with our omega-3 fatty acid? And now this is an individual recommendation, so do talk to your doctor or your pharmacist, because they understand your medications and any interactions that may happen. But generally, the research is suggesting that if we eat omega-3s through food, we will increase our omega-3s in our body a lot more efficiently than the supplements. Another great way to get enough protein without meat is through plant protein. So plant protein could be our tofu, it could be things from soybean, tempeh, edamame, could also be the beans that are here on the slide, which are black beans, kidney beans, lentils are a good source as well. These plant proteins are important to consume. It says 3 servings a week, but again, I suggest every day if you can. But start where you're at. So if you're not eating these plant proteins at all, then start just with once a day and try to work yourself up to 3 times a week. Eventually, that's 7 days a week. And a serving would be 3/4 of a cup. But again, start slow. So if this is new to you, start slow. Start with a tablespoon. Open up a can, start with a tablespoon of beans and incorporate it into your regular dishes, just so your body gets used to it, and then slowly incorporate it until you reach that 3/4 of a cup serving for the week, and continue to increase it. These plant proteins have so many nutrients in them that is one of the most important foods to start to include. The next one is our dairy and dairy alternatives. Those are dairy, so a cow's milk, but it could be plant-based beverage, which would be soy milk or almond milk. There's oat milk, lots of different options now, and as well as yogurt. And why we recommend consuming these 2 to 3 times every day is because of the calcium and the magnesium. I'm sure you've heard that calcium and magnesium are great for our bone health, which is true, but extremely important for heart health too. So what calcium and magnesium can do is they help with the contraction and relaxation of our muscles, and our heart is a muscle. So it helps with that, as well as our blood vessels, helps with the contraction and relaxation of that as well. So it helps the blood flow through our vessels a lot more, with more flexibility. And then we have our oils. Extra virgin olive oil would be the oil that we recommend. Having 3 to 4 servings of oil a day, and that a serving is 1 tablespoon. So that's 3 to 4 tablespoons of oil a day. So this is taken from that Mediterranean diet pattern, and that's because what they do is, in the Mediterranean, they eat a lot of whole plant foods. And in order to flavor their foods, they use extra virgin olive oil. So it is a higher fat diet, but just because we eat more fat doesn't necessarily mean we're going to gain weight or get more fat. So it's really important to think of your mindset when you're thinking about the foods to incorporate. Remember that these extra virgin olive oils has a lot of monounsaturated fats, a nutrient that can help lower cholesterol levels, our triglycerides, and help keep our vessels healthy. And in summary, this is actually Canada's new food guide. It's been around for a couple of years now, but some people aren't familiar with it. I really like this visual representation of our plate, because this is how we eat. We plate our food, and when you're looking at your plate, especially for lunch and dinner, think about splitting your plate into thirds like this. So half of your plate should be color, whether it's vegetables or fruit. That's your plant foods. Remember, all of those dietary patterns had fruits and vegetables at the bottom. So really important to get half of your plate. Then 1/4 of your plate is protein foods. If you can notice the foods that are presented here, it's not just animal meat, but we have things like fish, those nuts and seeds or legumes or tofu, even dairy and eggs can be here. And those are all heart healthy alternatives. So think about other forms of protein to include, and then keeping our whole grains to about a quarter of the plate as well. So it's not something you need to restrict in any way, but keeping it to about a fistful, about a cup or a quarter of the plate is a good measurement for the whole grains. And then just to touch on healthy eating on a budget, because I've talked about a lot of foods here and they're expensive. Our grocery bills have been on the rise in the last year, actually a couple of years now. And it's important to still consume these foods for our health, but we can do it without breaking the bank. So let's talk about what to do before grocery shopping. One of the things to do is actually to shop your house. So check to see what food you have at home before shopping. And that's something I did. We were away last weekend, and when I came home, I didn't get a chance to go grocery shopping. So I actually did this. I shopped my house, and we're still, we're midway through the week and we're still eating just food that we have around the house. So maybe take that as a challenge to see what's there, and then you're saving money without even going to the grocery store. Checking flyers for sales and discounts, really important, or even price matching can be helpful as well. So check those flyers. They come out every Thursday. Really important. Lots of apps too that help with that. Flip in particular is one that I really like. So try that. Planning menus for the week and making a shopping list based on that menu. A lot of the time when we go to the store without a plan, we end up buying a lot more food than we need. And then we waste a lot of food because we don't use it. So with a plan, we waste less and we spend less. And then one of my personal tips that I think is very important is don't go grocery shopping hungry, because if you're hungry, you'll want to buy everything and it's not necessarily the best choice for you, or you may be spending more than you need to. At the grocery store, make sure that you look at the top and the bottom shelves. A lot of the foods at eye level is, where we look right away. And when we're in a hurry, that's what we're going to grab. But sometimes the deals are up and below. So make sure you're checking those spots. And then buy those the store brand names, so like the no-name brands that are at the stores. They have the same, if you look at the ingredient list, very similar ingredient list. They taste pretty much the same as well. And they're sometimes half the price tag. So take a look at those and experiment. And then at home, buying less prepared processed foods and cooking your meals at home, something that's consistent with those dietary pyramids, can be helpful to actually save money, because the more processed the food, the higher the price tag.
Thank you, Veronica. The tips you shared are wonderful and something people can hopefully use in their everyday lives. So that brings us to the end of our formal presentation. And I want to take a moment on behalf of the patient education and engagement team here at UHN to thank all of our speakers, Rick, Dr. O, and Veronica, for sharing your incredible expert knowledge with us today. Before moving to some questions, here are some resources that we will include in the description box below. These are a list of websites you can find various recipes on a budget. There are also some resources in Ontario that provide access to food. You can search for a food bank in your area near you, and food banks also allow opportunities to volunteer or donate. You can also access cardiac rehab programs across Ontario or also here at UHN, and the links to these websites will also be available in the description box below. And you are always welcome to contact the Patient and Family Learning Centers at UHN. They offer reliable and up-to-date health information to patients, families, healthcare providers, and members of the public. All of their services are free and available in multiple languages. You can always call, email, or visit their centers Monday to Friday, 9 to 4. So that brings us to the question and answer component. As mentioned before, we had questions submitted from patients, caregivers, UHN staff, and the general public. We'll go through some of those questions now. So our first question, and I think this is a great question, Rick, to bring you in. What have you found beneficial about cardiac rehab?
For me, Elena, the most beneficial thing really has been finding out that I can do it and getting the habit built of exercising every day and learning how to feed myself in a healthy way. The other piece which helps with the ongoing fitness is through the cardiac rehab group. I've connected with a peer support group. We meet monthly, and also a running group. So it helps with the ongoing maintenance of my heart health. And those to me are the most important things, the knowledge and the ongoing connections.
Definitely the physical and mental health is really important in building those social connections. Thank you, Rick. Our next question is statins and debilitating muscle pain can cause using a natural product such as plant sterols with CoQ10 by natural products or substitute statins. And it goes on to say, my doctor states muscle pain is rare from statins, but I know numerous people that complain of muscle pain with statin use. Dr. O, maybe you could share some insight on this.
Yeah, thanks very much for this question. Very important. First of all, I guess we start with statins. Statins are the class of medications that are commonly used to manage cholesterol issues, particularly in people with heart problems. Statins work by blocking the production of cholesterol and thereby can actually lower cholesterol levels by about 50%. And this is really important to stabilize coronary arteries, perhaps reduce the chances of having future heart attack or stroke. So there's a good reason to use these medications beyond lowering the blood value of the cholesterol number, the LDL in particular. Every medication has the potential for side effects, and muscle aches and pains have been described and reported on in the literature as well as on the internet to a fair extent. I tend to agree with the lower statement that doctors tend to think that muscle aches and pains are important, but they don't occur that commonly that are truly related to medication. About 1 in 100 people will report muscle aches and pain. Much less than that, like 1 in 1,000 or less, have more serious problem of muscle aches and pains and inflammation. Now, having said that, muscle aches and pains are common in all of us. Muscle aches and pain are common in people who are in the demographic age range of people who might experience heart conditions, and muscle aches and pains might affect 30 or 40% of us. So figuring out if it's the statin medication or if it's life, that's an important differentiation. If it's related to statins, I tend to think that if big muscle groups like the thighs or the back or the shoulders are being affected all day long, then this might be the statin medication. If it came on after you started the statin, and if it goes away after you stop taking the statin, well, then that's kind of more information that might indicate the statin's the problem. Is there a substitute? Yes, there are other medications that one can use instead of a statin to lower cholesterol. There are some, quote, natural products. Plant sterols are described, sugarcane extracts, things from red rice yeast have been described. The unfortunate thing is they tend not to lower cholesterol as much as we would really like for people with heart disease in particular. And supplements like coenzyme Q10 may be helpful for some individuals, but it doesn't seem to have an effect universally for everyone. So if it's a problem, identify it, chat with your doctor and your pharmacist. If it's really the statin, then you can find potentially a substitute for that. And there are some good new therapies for this as well. And supplements may be helpful to manage the muscle pains. Thanks.
Thank you, Dr. O. Our next question is on cardio training versus weight training. How do you balance both, and how does the balance change as you age? Dr. O.
Thanks. Well, I'll take this one, and I appreciate the question, and I appreciate that folks are interested in exercise. And my answer is yes, both. Both are important. You saw in our healthy recipe, and Rick described this as well, that doing the cardio / aerobic or endurance training is really important. Getting out, walk, jog, swim, cycle, wheel, whatever works for you, but doing it regularly and preferably about 5 times a week is really important. And that's great for our heart and blood vessel health. the cardiovascular training. Weight training using a band, a soup can, a water bottle, or weights or weight machines, depending on what's available to us and what kind of weight we want to use, is also really important. We know that after the age of roughly 40, that our muscle mass starts to go down. So we really need to defend this on a regular basis. So doing the weight training 2 or 3 times a week in combination with the cardio training is really important. And the weight training as we get older is particularly important because that's when we're losing most of our muscle mass, as well as bone health is affected and metabolic health and probably brain health as well. So think of your muscle as a marker for what else is going on inside of your body and defend that through some regular just exercise at home. Thanks.
Thank you. Our next question is, how often in senior years should one have a blood test, and what is the indicator or reading identifying a silent heart attack? And would this show on a cardiogram? Dr. O, I'll bring you in again.
Well, thanks. And so as we get older, we'll have those periodic check-ins with our healthcare practitioners, and probably on an annual basis, getting your basic blood work screened, like a blood count, blood salts, kidney function, and for people whom we see, having a check of cholesterol and blood sugar, and sometimes we may do some other detailed metabolic tests, like checking out your thyroid and things like that. Those would be the basic things that should be done for most individuals. None of it particularly speaks to what's going on with our heart. Now, a few of you may have had the experience that you went to hospital for something else. They did a blood test specific for the heart, something called a troponin test or a creatine kinase, CK. And the team may have said, hey, it looks like these blood markers are high and there's something going on with your heart. But doing it kind of randomly, if we're feeling well and walking around or out in the community, probably does not have much benefit for that. The second question deals with that electrocardiogram and we did look at those interesting waveforms that identify the electrical patterns with the P and the spiky QRS and the T. Well, those waveforms, when they're put onto a whole kind of 12 lead pattern, so a whole bunch of different angles on the heart, can demonstrate or be suggestive that there's something that's happened to a heart. And some of you may have been in that situation where you've had the annual electrocardiogram, and the doctors may say, hey, it looks like there's something that happened to your heart. Some heart attacks can actually be, quote, silent. That is, you may not have the chest pain or the shortness of breath or something else that happened. You may have felt like you had the flu for a couple of days, something like that. And that's where the electrocardiogram may pick things up. So follow the pattern that you and your healthcare practitioner have identified for your annual check-ins. I don't think you need to do anything else fancier, kind of looking for heart problems beyond these routine tests that are tried and true. Thanks.
Thank you. So this question is about, can heart issues cause neuropathy in the lower extremities? Are there any drugs that are currently being prescribed for heart or other heart problems that can deteriorate nerve endings if used for an excessive period of time? And thank you for this forum.
Okay, well, thanks very much for that. Heart issues directly don't necessarily link with nerve problem. Neuropathy, neuro is nerve, and pathy is bad. So bad nerves in the lower legs. So the heart doesn't directly affect the nerves, but there are associations around people living with heart disease. If I hear somebody that has a nerve problem in the feet, for instance, I may think as my first kind of question, do you have diabetes? Diabetes affects the heart. We know that. Diabetes also can, in some people, have a complication of nerve problems in the feet, numbness, tingling, that sort of thing. So that may be the connection between heart and the lower extremities. The other thing I would think about for some people is that if there are blood vessel problems that affect the heart, there may be small blood vessel problems that affect the rest of the body, including the blood vessels that go down the legs and into the feet. And if those small blood vessels are affected, they may affect the nutrition, the microcirculation, and the small nerves in the feet. And some people will feel numbness, tingling, pain in the lower extremities associated with those kinds of blood vessel problems. The other thing that sometimes we see is not, again, directly related to the heart or the nerves or diabetes, but just part of us getting older. And Veronica's part of the session is really critically important, that we have overall good nutrition. That if we're having a lack of certain nutrients like vitamin B12 in our diets, that we may not have enough. Vitamins are important for proper nerve function as well. So of the drugs that we are commonly using for the heart, I wouldn't think of them as being associated with nerve problems, like drugs like aspirin or beta blocker medicines or statins or other blood pressure drugs. Those would not be common associations. But again, people that have heart problems who are taking those medications may also experience nerve problems kind of concurrently. So, I wouldn't worry about nerve problems as a reason not to take my medications. But if you had nerve problems, please identify it to your healthcare practitioner to explore if there might be some of these other things that are going on. Thank you for the question.
Thank you, Dr. O. The next question is, what deficiency in our body, such as vitamins, are responsible for heart health, and also advise on diet and ingredients important for our heart health? So Veronica, I know we already spoke about diet and ingredients, but I wonder if you have any insight on the first part of the question.
Yeah, absolutely. This is a fantastic question. So thank you. Some deficiencies, I guess we could look at it like in Canadians, there are some deficiencies that stand out, but it could also be individual as well. So if you want to assess yourself individually on an individual level, I would say talk to a registered dietitian to find what kind of deficiencies may be happening in your eating pattern. But on a larger scale in Canada, some of the deficiencies that could be responsible for our heart health two come to mind. One is a nutrient called soluble fiber. So not having enough soluble fiber can be really important. And the other one is potassium. So I'll start with soluble fiber. So there's two different types of fiber in our food system. One's insoluble fiber and one's soluble fiber. And I think people are really familiar with the insoluble fiber. That's like the brand. It keeps us regular. But soluble fiber can be extremely important to help us eliminate cholesterol molecules. It's fantastic. It actually binds with bile in our system, and bile is made up of little cholesterol molecules. So when soluble fiber is bound with bile, then we eliminate it when we go to the washroom. We can actually eliminate cholesterol that way. And so I think it's a really important nutrient to make sure you're having enough of. And I think that in Canada, we know we're not having enough fiber in general. On average, we're eating about 12 grams, and we should be having somewhere between 25 grams for women, 38 grams for men. So we can improve there. And then particularly look into that soluble fiber piece to help. And soluble fiber could be found in things like avocado, barley, certain fruits and vegetables have them. So pears, okra, eggplant are good sources. And then our nuts and seeds like flaxseed, chia seed are also great. And then the other nutrient is potassium. Now, potassium is actually a nutrient of concern for all of Canadians. And I don't know if you've seen this on our food labels, but in the last few years, we've updated our food labels and they've taken away some of the minerals and vitamins that were on our food labels in the past. So we had vitamin A, vitamin C, and now Canadians are eating enough of those. So those aren't nutrient of concerns and they're not on the food labels anymore. And they've replaced those with the nutrient potassium because we're not eating enough. And I'm sure you've heard for heart health, we want to restrict our sodium intake, right? So that's pretty common, but potassium does the exact opposite of sodium in the body, which means that if we eat more potassium, it does the exact same thing as restricting sodium. So that is how potassium can help our heart health. And if Canadians are not eating enough potassium, that can be one of the deficiencies that could be affecting our heart health. And whereas potassium it's found in everything. I'd like to say a lot of plant foods, if you want to be more specific, but our fruits, our vegetables, our legumes are really important. So that's things like chickpeas, kidney beans, lentils, black beans, for example. And then our nuts and seeds would be a good source as well.
Thanks, Veronica.
My pleasure.
Our next question is, what food could help to lower cholesterol? And I know you mentioned a few of these before. If you could quickly sum up some of the foods.
Yeah, absolutely. Yeah, I did mention a lot of different foods in the presentation, and I think all of them can actually help lower cholesterol. If I had to pick one, I'd say it would be focusing on our legumes. So that's our chickpeas, our kidney beans, lentils, black beans. It's our protein from plants. So a lot of the time when I'm seeing individuals, they are eating less protein from animals, so less meat, which is fabulous to help lower cholesterol, but we're not replacing it with protein from plants. And so I think focusing on that can be really helpful to make sure we're having enough protein. But those legumes are a great source of that soluble fiber, which I just spoke about, which can really help lower cholesterol levels. And legumes are also really beneficial in other minerals like that potassium, but also magnesium. Some are rich in calcium. So lots of great things that can help the heart or muscles or vessels even contract and relax, as well as lower our cholesterol levels.
Great, thank you for that. So that brings us to the end of our questions. Before we end, for those watching, your feedback is important to us. Please go to the link on your screen and complete the survey at the end of the Health Talk video. The link is also available in the description box below. And we thank you in advance. Your feedback helps us to know what you liked, what we can improve on, and what topics you would like to see in the future. And to keep up to date with our health talks, you can subscribe to the online patient e-newsletter and get up-to-date information about events and new resources at UHN. To fill out a form to subscribe, you can go to the link on your screen, and we'll have it available in the description box below. And finally, our next session in March will be on wellness and recreational activities for seniors, sharing strategies to be your best self. In the meantime, you can start submitting questions now for the speakers. Thank you for watching, and see you next time.